Anyways, all right, so we got Dr. Andres here all the way from Chile. He came here just for this interview.
Yeah.
And you're a prosthodontist.
Yeah, I'm a prosthodontist.
So how long ago was your training?
A lot.
90s, 80s?
No, not
70s?
No, not so. I'm not so old, man.
No, actually, here, tell us, what are you doing in New York?
Well, usually I travel a lot, so the United States is one of the places that I have to travel often. But now I'm here specifically because I have to teach on NYU. I was on Friday there. This was today again for the international program in NYU again. And Saturday was our course on these exceptional facilities of the clinic, So we're in Trinity Church, by the way, in Wall Street. Great place. We have a lot of people. It was fun. It was good.
How many courses have you given in your life?
I don't have a number, but we
over
have
100?
But with the team of Focus, the Focus team, that we are three guys, one fashion photographer, Pablo Wilson, and my other colleague, a prosthodontist, Sebastian Cifuentes. Since we started in 2017, could be around 3,000 attendees.
Wow.
I don't know how many courses because that's a round number, but we have done this a lot of times, that for sure.
And you're a prosthodontist.
Yeah, I'm a prosthodontist.
So how long ago was your training?
Well, that was a long time. You're younger than me a lot.
90s, 80s?
No, 90s.
70s?
No, not so. I'm not so old, man. Don't be like that.
No.
2009.
Oh,
I finished the dental school in 2006.
Yeah.
So I started my program, 2009 till 2011 when I finished. And then
you finished dental school in 2006.
In 2006.
And you started 2000.
Exactly.
Okay.
Yeah. So it's a little bit longer in Chile, It's a full program, so you have to decide and choose what are you going to study.
Yeah.
For sure, at the beginning. So.
But is it what is it? It's just 6 years, no college.
No college.
So you actually are saving time overall.
Saving time, but you gotta be sure that is going to be your career for the whole life.
Yeah.
Or in my case, create your own path, basically.
What school did you go to in Chile?
Sorry, what?
Which school did you go to?
La Frontera University. It's in the south of Chile.
The south, okay.
The same city that I live now.
Oh, okay.
Yeah. It's a nice place, by the way. It's a nice city. You can go there and visit me.
Yeah. Everyone's invited.
Yeah. We have lakes, snow.
I've never been.
Good beef.
I went to Neltume. That was like Neltume?
Neltume is close to that.
Yeah.
How do you know? You have been there?
I went to it was like some community service thing we did. It was called Friendship and something.
Really?
With Dr.
That was with a friend, with Carlos Cáceres.
Yeah.
You know him?
Yeah.
He was my teacher.
Oh, no way.
Yeah, from Universidad del Desarrollo.
Yeah, that guy.
Del Desarrollo University.
So
yeah.
I went with him and Rodrigo, the radiologist. There's a few people, yeah.
Yeah, you never told me this. This is the first time. What the hell?
For this moment.
You were saying, yeah, you have classified information.
Yeah.
They do that, not with me, because I never was there, but they have this initiative, to invite the people from the university to work in this summer camp or summer, voluntary work, basically,
Yeah.
Pro bono.
That's what I did, yeah.
Yeah, it's a great idea.
We were there for like a week. It was a great time. We got to meet the the students from Desarrollo, and what's the other one? Another university.
Yeah, with the people with that guys, I study. He was my teacher when I did my residency in Pusto.
You should do the program.
Well, I don't have time now, but it would be in some moment. It would be nice to do it.
Yeah, it was really fun.
Yeah.
And then,
I was with him, a couple of months ago because now I'm part of the program of Prosto.
Okay.
Yeah, I teach once a year there.
Small world.
Yeah, small world. Yeah.
So all right, so to go back to where you were, so you went to high school, right?
Yeah.
And then you went right to dental school.
Exactly.
How did you know you wanted to be a dentist?
The truth?
Money?
No. Yeah, well, always money, but
Yeah.
the truth is I always had a good relation with science.
Okay.
But on the other hand, I love the art.
Yeah.
but I want to. In some moment, I wanted to be, plastic surgeon.
Yeah.
But then I realized that the people could die, and that is not good. Too much
Yeah.
responsibility. Dentistry is easier in that way. Now dentistry is not so easy. There's a lot of competition and everything.
Yeah.
But on the other hand, I got a lot of time working on this, so I know this job very well. And I think that helped me a lot, to decide and do. That's why I studied prosto, because I love that
Yeah.
to work with the hands, to see results, immediate results sometimes even,
How long is Prosto? 3?
2 years.
2 years, okay.
2 years.
Yeah.
So it's fun, when you love what you do, and I love what you do. Lucky for me, it's fun,
Yeah.
The results are good.
And when did you get into the photography?
Well, I was always involved with photography, but never like now, not lecturing or teaching, But I guess it was very related with when I started to study my residency in Prosto, Then I decided I have to do something with this, I wanna take pictures, good pictures. I wanna take the best picture that I can, I remember one time when I was, probably Sidney Kina, a guy from Brazil, a Japanese Brazilian guy, and this guy has a book, and this book is beautiful. So I saw the cases, when you open the book, it's giant, and you see a full smile, with veneers and everything, and the picture was just awesome. So when I saw that, I decided, I have to do this. I want that picture made for me. Made, and with the picture, it should be for my work.
Yeah.
Well, so I decided that I want to take that picture,
Yeah.
do the job, and take the picture.
Yeah.
I want that for me. This is for me. It was a long way, It wasn't easy because I never took a formal course. So I did a lot of rehearsal, and doing things wrong, basically, to learn by mistakes. But I guess at the same time, it was super good for me.
How long did it take you to learn?
I don't know exactly in years, but probably for 2017, I was done with that, I was ready.
Yeah.
But it took me some time, it was not immediate, it was not right answers, or wrong answers. And it was like, this is working well, I like it. Then I saw something, well, that's not so good. I want that, and I want this. I want this equipment, I want this camera, I want this lens, this flash, and everything.
How much
I was
money?
evolving, basically.
How much money have you spent on camera gear?
I don't know, man, but I don't spend so much money as you
No?
think.
Okay.
I'm the guy who teach you how to spend not so much money
Okay.
in photography.
Because it can be expensive.
Because I think it's overrated.
Okay.
By the way, photography is not rocket science. It's something that everyone could do. The thing is that we're trying to do this for dentistry. Dentistry is complicated. The life is complicated. Photography should be just a tool, But there's a perspective from some people in dentistry that they want to show like if this is complicated or it's like a specialty, in dentistry or something. It's just a tool, man. It's just that, and nothing's gonna happen if you take a bad picture. The thing is that you gotta learn from that. Mm-hmm. That's the thing.
But don't you think it's hard to take pictures in the dental office, or no?
No. With the right guidance, you can take some nice pictures.
Do you take all your own pictures?
Yeah, I take my
Or
pictures.
you don't teach
I
the
have to.
assistants?
Huh?
You don't teach the assistants or anything?
I teach a lot of people, I could teach to my assistant. She knows some stuff, but I guess, and I'm not saying that it's bad that you train your staff, I do that a lot, In my courses, sometimes I receive the whole team from a clinic or a practice. But the thing is that I think that in my case, it's more honest, to take my pictures, because if I'm gonna show you something, I have to do it by myself. And for me, it doesn't take too much time, to do that. It's just a couple of minutes.
It's kind of like, I don't know, for me, it's like a director, they don't film the movie, but they kind of like tell everyone to do it and it's still their movie.
Yeah.
So you could like tell everyone what to do
Could
and
be.
there's still your pictures.
You don't have to do everything, but in my case, I feel that I have to do it.
Okay.
It's just because I show a lot of my work.
Yeah.
I do a lot of cosmetic dentistry. Basically, my practice now is basically cosmetic dentistry, veneers, the whole day. Not the whole day, but all the time, all my patients are from that area. So I like to show the result of that, And I think that is more honest to me when I do a treatment acceptance, or I show a treatment or previous treatments to show that kind of work, made for me, even with the pictures.
How long does it take you to take the pictures?
How long? Well, a couple of years, probably.
No, but like with the patient.
I don't know, not so much.
Yeah.
My protocol is simple, face, portrait, or extraoral, smile. I'm talking about cosmetic, retractors in occlusion, and then contrastor.
Mirrors.
And that's about
It's like 5 minutes?
5 minutes.
And are you uploading them and editing them? Or you have your staff do that?
No, just like that. I put the pictures, download the pictures, I show to the patient.
No, but like
first day.
you don't have to like crop it or anything, no?
When I want to show the cases, formal stuff like a course, lecturing, of course. If I'm gonna save the case before and after, for example, I put everything in a folder, and then upload to Dropbox, and that's it.
Yeah.
Because and this is one thing that is important, I guess. I try to work on the best way to take a picture because I think and I feel that this is an ingredient of the recipe. So I try to take care, to do things well when I take a picture. I concentrate. I try to frame it good in the center. The right light, the right settings, and everything. Yeah. Because like this, I'm gonna obtain a picture that is ready to use now. Why it's important? Because immediately I'm gonna show that picture to the patient.
Do you have it like hooked up to a Wi-Fi card that goes into the computer, or
no, just download because there's no wireless system by now that works well in that quality.
Okay.
The only way to do is is with a wire basically. You have to connect with a mini HDMI to the camera to the computer or something else.
Yeah.
So I prefer to just take the card, connect it to the computer, search for the picture and show to the patient. That's it. That's gonna take you 1 minute or less maybe. But if you do the picture in the right way, basically the work is done.
Yeah. So what inspired you to start a course?
Well, I thought and I saw a lot of courses, and I didn't like it the way, I worked on
2017.
Before that.
Okay.
I was already working on marketing because I work as a marketing advisor for some companies. And a lot of companies had to sponsor courses and things like that. So I used to go, a lot of courses to see what is happening or help even, with the marketing. Sometimes they hire me, sometimes the companies or sponsors hire me to go there, to do stuff. So I saw the course, I used to go to the course, and I didn't like the way that they treat, the education on this area, because they make it feel that it was something difficult, complicated, with a list of things that you need, things that were not necessary at that time, I feel. Yeah. And I thought that it would be maybe a better option if I try to bring a different approach of that. The other thing that I never felt, that it was possible to understand for me, was why someone that is not a photographer is teaching photography. So that's why I decided to have a team, basically. Mm-hmm. Because the thing that I was watching at that moment, it was like this guy took a course and now he's teaching. And a guy from that course took a course with the guys and now he's teaching. So basically it was all the same. It was a chain of things, happening because someone told you that and then you repeat. So when I decided to create this course, the focus course, was my first option was search for someone who was at the moment, the best fashion photographer, because this guy's a professional. This guy has a title on the wall that said that he's a photographer. So I'm gonna
to take pictures of me. When's he coming?
Yeah, tomorrow probably.
All right.
In my case, when I decided to teach marketing in dentistry, was the same thing. I take a diploma, at the university, and I study 1 year marketing and digital marketing.
Cool.
Because I decided to teach based on something that it was at the university first to confirm that was the right decision, and the right information. In the case of Sebastian, for example, he teach photography in surgery because he do a lot of surgery. So as you can see, we try to teach in the field that we work, basically. Not because someone told you that it is like this.
Are you the only course with an actual photographer?
I guess so.
Might be.
Probably.
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 And then...
We're a team.
Yeah.
And we have a very good synergy. We are very different, by the way.
And you do English and Spanish?
English and Spanish. All the team, the whole team.
Oh.
Yeah. That helps
Yeah.
to make it more interesting.
Do you like it better in English or Spanish?
I like both. It's different. It's different, but it's good in both ways.
Yeah.
We have, of course, a better connection sometimes with the people in Spanish. Sometimes we have a great connection with people in English. It depends on the people, basically.
Yeah.
For example, the past court here on Saturday was great. The people was very receptive. They were very happy. We had people that it was mostly from here,
Yeah.
and they were very, warm, basically, on the relation that we create that day. So it was a nice moment.
And how they all find you? Like if you're from Chile?
Instagram.
Oh,
Social
everyone was
media.
from Instagram.
Social media.
That's the only marketing you did for the
Yeah,
course.
social media. That's it.
And were you running ads or you were just posting organically?
Sometimes I put some money there, but
Yeah.
not too much.
Not too much.
So if you're investing there, it's a good way to understand how the market works.
Yeah.
Because if I'm in Chile, in the south of Chile, selling to New York, it's because it works.
Yeah.
Social media works.
What do you? Was there a moment when you realized, like, 'cause I'm sure, I don't know, maybe it was in 2017. Did you have immediate success, or like, was it kind of slow and then?
I don't want to be cocky about it, but
Yeah.
the first course has 15 attendees.
Okay.
And our number was, for that moment, 15. So we said, if we have 15 to this price, probably it's going to work.
Mm-hmm.
And it works. And that was the first one. And since now on, we didn't stop. We always trying to grow and make things better, but we're always doing courses. Always.
Do you have a vision to expand to other topics, or?
It's natural to think that you can do more stuff. For example, in my case, I'm doing courses about veneers or aesthetics or, I don't know, marketing, that kind of things, But you try to work on your area, your comfort zone, basically, the things that you know best, I try not to go to places that I don't like, basically, or topics that I don't know because I don't feel comfortable with that.
Mm-hmm.
I think this is my topic, I do a lot of veneers, so I speak about that too.
Yeah.
Aesthetics, marketing is my thing because I work on that as a marketing advisor for companies. So I think you got to do what you know best, basically.
Did you take any courses on teaching?
How?
Like how to teach, or like how to?
Probably something that I have to do at some moment.
Yeah.
Yeah, because I worked in a lot of universities, always as a guest professor,
Okay.
Like for example now, in NYU, but I don't work stable in a university.
Mm-hmm.
I work by myself basically, So if they invite me, perfect. I'll go there, I do my best, and then I finish, and that's it. See you next year.
Yeah.
But it's kind of cool at the same time, You don't have too many responsibilities with that. You go there, do your best, and that's it. It's a good way to work too.
And with all this lecturing, like how much time are you actually in the clinic, like in your practice?
Well, I don't do too many practice. Probably it's gonna be around 10 hours a day. A week.
10 hours a day?
No, 10 hours a day is too much. A week.
Okay.
That's the average. But when I'm not there, there's no practice. But I try to organize this with my patients and everything, They know. Was
this your vision when you first started, or?
It was very different.
Yeah.
Very different. I never thought that it was possible, I can say that it was a dream.
Yeah.
Because it wasn't, my dream was to have a job, basically. I was just, I will not say a kid, but I was starting,
Yeah.
I got a family, so I was starting with that too, a lot of projects, basically. And at that moment, you just want to work, receive money for that, and do your best. But with the time you start to see that probably this is not for me. Probably I have more options.
Yeah.
Probably I can do more, But the thing is that if you ask me, there's two important things here to understand, One, try to do your best with the things that you have. Whenever or whatever you are, Try to do your best. Don't think that it's just do the minus effort, basically. And two is that you never know who's going to watch that. So I always say, act local, and I don't know, I don't remember exactly the phrase, but it's
What's in
think
Spanish?
local, act global. You know,
I think
try to do the things your best you can. You know, because you never know who's gonna watch that.
Yeah.
And something happens. You know, you find with incredible people. They're like you, like your dad. You know, it's cool. You know, because we know from other friend. You know, Mike Sonic. And Mike Sonic, I know him because of the guy. You know, it was like he was lucky probably,
Yeah.
or probably there was opportunities. You know, available at that moment. You know, and I was in the right way. I don't know. But probably it's because I was doing a lot of things since a long time too, you know. I don't know. But you gotta do the things good, you know, well. Same with patients, you know. Same with everything, you know.
Yeah. And you said you have a team. Do you also have someone that helps you, like organize, like talk to
No.
the attendees or?
No,
organize the room?
I have a control about everything. It's something that I have
Do you
to.
order lunch
uh,
too?
No, I have catering, you know, I call someone, but here, you know, it was a mess, you know, because we have everything higher, you know, and the day before they call us, you know, we had a problem, you know, we can do this. What? Are you kidding me? So I have to resolve, you know, but again, I think now I have the capability, you know, to resolve anywhere, everywhere, everything, you know. It wasn't difficult, you know. I call a couple of places, I go to a place, you know, here, you know, everything. Done. A couple of hours, everything was like it was, you know, planned like months before, like we did with the other option.
Yeah.
But it was good. The people was happy.
They were happy.
Yeah.
Of course they were.
It was nice. It was
So
good.
what's your next stop?
Next stop. Well, now I'm going to a restaurant. But the next stop, you know, I'm going back to Chile. Next week I have to be in Miami. Have a course on Friday and Saturday with Dr. Martos there, you know. I'm helping on a course. It's not my course. I just do the photography part. And the following stop is Sarasota, October 4th and 5th.
Cool.
And then the next one is El Salvador. Like we say.
Wow.
And the next one is Mexico. And then courses in Chile. And then we stop for this year, I guess.
Yeah.
I guess.
Any last words? Last piece of advice? I don't know. Anything?
First of all, thank you for the interview. You know, I like a lot, you know, to share with you guys. You're very cool. I like a lot your style on Instagram, you know.
Oh,
I think you're doing well, you know. I can do that, you know. I try to take pictures and speak through the pictures. I'm very bad with copywriting, you know. I'm very bad at speaking, you know.
You're good at speaking.
Yeah, but not recording.
Okay.
And that's you know, that is it's something good, you know. It's not easy. I'm happy to go to different places because I feel that I have friends in a lot of places, you know, and that's a good thing for me. It's not only work, and I feel that here I have friends, and I'm happy for that. And the other thing is that don't limit yourself. Basically, you know, photography is something for everyone. It's not rocket science. That's it.
Awesome. All right. Cool. Thank you. Gracias.
Thank you.